Hey everybody, Dr. Wenzel Brentwood, MD. Welcome to the third video of our three-part series, all on male infertility. This video is really meant to just be a summary of action steps and answering a few of the most common questions I get in regard to male infertility that come from men in my private practice, and maybe those will be useful answers for you to have. One of the questions that I would like to address before we get into the FAQs are, where do I go to find a male fertility specialist in your market? And I think the best place to go is the ASRM.org. This is the American Society of Reproductive Medicine. And anybody who is in this space is likely going to be an active member in this, because this is the cutting edge, latest and greatest. So that would be a great first resource. Then obviously just getting into your search engines, Google of the world, and search for fellowship trained male fertility specialist. If that doesn't yield anything, sometimes it can be a little elusive because they are hard to find, and a particular website may not have the right SEO strength to be findable. So what you could do is just identify the 2 or 3 largest urologic groups in your market, and then skim through their providers to see if you find any evidence that there's a fellowship-trained male fertility expert. I think that would be a great place to start. As far as the most frequent questions that I get, far and away, is freezing sperm a viable option? And the short answer is yes, absolutely. It's absolutely a viable option. I think there are a couple of things to consider, and that is, what is the age of the man? A younger man that may meet someone in the future but still of reproductive age. If you're freezing sperm, you wouldn't be able to do that naturally. You'd have to go the IVF route, so thinking about that. And before you do any freezing, you absolutely need to go through the checks and balances just to verify that you have viable sperm to freeze. But if you're in a situation where you have viable sperm and you know that the likelihood of expanding your family in the future is going to be through artificial kind of mechanism or technology, this is very viable. It's a little expensive, but I would consider it, and I would ask for your male fertility specialist to help you think about that and identify someone in your market that could be a reasonable option. Second most common question I get is fertility after testicular trauma. So sometimes young boys have blunt testicular trauma, which can absolutely affect the anatomy, blood flow. There are certain medical emergencies that take place in young men's lives called a torsion, which restricts blood flow, that twists up, and a lot of men, unfortunately, if you don't catch it in time, they can lose a testicle. And these certainly all carry with them increased risk of fertility issues in the future. If you have any history of testicular trauma, absolutely one of your first steps, getting a male fertility evaluation. The third most common question I get is how to think about family planning after you had a vasectomy. And the short answer is you can definitely still expand your family after a vasectomy. I think the way you would answer there's one of 2 ways. You can do a sperm extraction from the testicles, which would be a very viable option for someone who didn't want to go under general anesthesia and knew that they were likely going to not be able to have a child naturally, and they were going to use IVF, because that extracted sperm would likely then just move right into one of these more advanced technologies. If you want to try a natural reproduction effort after vasectomy, you can have a microsurgery from one of these male fertility specialists who are uniquely trained under the microscope to do surgeries to reverse the anatomy that was changed. And the outcomes of this are way better than you would think. I'm being told to fertility of a viable pregnancy about 70 to 75%. That's pretty good. Now, it's still not 100%. 1 in 4 will still have to pursue the in vitro kind of stuff, but still, you have options. I really hope this video series has been useful to you. I hope that if you know someone who's walking through this, you'll feel free to share it. Please leave your comments of anything that you liked, any questions that you might have, and I'll be in the comments. And until we meet again, everyone, take care. Bye-bye.